Anisha Hardy.
I'm Nikki Warmeyer.
Christy Mose.
This is our poster. We're going to be discussing skeletal system, the human skeletal system. The human skeletal system is made up of 206 bones, cartilage, ligaments, and tissues, all working together to provide many functions that a human needs to survive. This can all seem very overwhelming until we start to break the skeletal system into smaller sub-areas. The human skeleton can be divided into the axial skeleton and the inframandibular skeleton. The axial skeleton provides support and protection for the brain, spinal cord, and internal organs, serves for muscle attachment, direct respiratory movement, stability for the appendicular skeleton. The appendicular skeleton functions are the pectoral bones serve as a point for the upper limbs attached to the body. The pelvic girdle bears the weight of the body and is responsible for the movement. The pelvic also serves as an attachment point for the lower limb. The lower limbs support the entire weight of the body and absorb any force caused by movement. There are 4 types of bones that make up the 206 bones in the body.
Long bones consist of 2 bulky ends or extremities, mainly compact bone. They can have a large amount of spongy bone. Long bones include the thigh, legs, arms, and forearms. Short bones are cube-shaped. Their dimensions are horizontal, vertical. Short bones are mainly spongy type bone covered by a thin layer of compact bone. Short bones include the wrist and the ankle. Flat bones are thin, flattened bones. Most of the time, these bones are curved. Flat bones have a layer of spongy bone that is sandwiched between 2 layers of compact bone. Irregular bones are not in any of the other 3 categories. Irregular bones are mainly spongy bone covered by a thin layer of compact bone. The vertebrae and some bones in the skull are irregular bones. Now that you know what the skeletal system is made of, are you wondering what's the point?
The 6 main functions of the skeletal system are support, protection, movement, blood cell production, storage of mineral and mineral homeostasis, and endocrine regulation. Support, with skeletal, without skeleton. The skeleton provides the structure framework which supports the body movement and maintains the body shape. Without a skeleton, the human form would be shapeless. Protection is a very important function for a specific bone, such as the skull or ribs. Without the protection, these structures would collapse. For example, the skull protects the brain, the vertebrae protect the spinal cord, the rib cage, the sternum, and spine protect vital organs like the heart and the lungs.
Movement. The skeletal system is held together by a network of ligaments and tendons that attach the muscles to the bones of the skeleton. The skeletal system are what allow movement. When a muscle contracts, it pulls on the bones in the skeleton to produce movement. The shape of the bone and how they fit together at the joints allow for different types of movement as well. Think of the way your elbow moves versus how your shoulders move. Blood cell production. There are 3 types of blood cells. Red blood cells, which transport oxygen throughout the body. White blood cells that fight off infections in the body. And platelets, which help blood flow. All of these blood cells are produced within the skeletal structure. They develop from hematopoietic stem cells and are formed in the bone marrow through a highly regulated muscle system. Storage of minerals, mineral homeostasis. Bone tissues store several minerals, including 99% of the body's calcium and 85% of the body's phosphorus. The bone will then release the minerals into the bloodstream as needed. It is vital to the body to keep these minerals within a tight range. For example, if calcium gets too high or too low, the muscles and nerves will not function properly. Endocrine regulation, storage of chemical energy. The bone cells release Ostocalcin is a hormone that helps regulate the blood sugar in fat deposits. Ostocalcin serves as an important chemical energy reserve. 6 functions of the skeletal system: support, protection, movement, blood cell production, storage of minerals, endocrine regulation. How does the skeletal system work with the other systems of the body? Muscular system. The skeletal and muscular system work together to enable the body to move and maintain proper posture. Muscles attach the bones at various points in order to change the bone's position to one another at the joints. Exercise causes the skeletal system to become denser and stronger. Circulatory system. The marrow inside the bones are critical to circulatory system. The marrow inside the bones produce the red blood cells which oxygenate the body and white blood cells that fight off disease. Once the marrow has produced these cells, they are released into the circulatory system and move throughout the body to do their job.
Endocrine system. The endocrine system produces hormones that provide how the bone will grow. The bone cells also produce hormones, specifically osteoclasts. Osteoclasts are bone cells that help regulate both blood sugar and fat. Integumentary system. The integumentary system is an organ system that includes skin, hair, and nails. The purpose of the integumentary system is to protect the body from outside damage. The bones of the skeletal system are reliant on the integumentary system. The integumentary system produces a vitamin D, which is required for calcium absorption. Without vitamin D, bones lose calcium and become more brittle.
There are 3 main medical problems or diseases associated with the skeletal system: leukemia, osteoporosis, and scoliosis. Leukemia is a cancer of the blood. Leukemia occurs when the body's marrow starts to produce too many white blood cells. These white blood cells then begin to crowd out the red blood cells and platelets. The overcrowding by these white blood cells prevent the body from getting the oxygen to the tissue, controlling bleeding and fighting infection properly. Leukemia is caused by chromosomal abnormalities and has been associated with genetic disorders such as Down syndrome, Bloom syndrome, and Fanconi anemia, and immune deficiency disorders. However, no one knows exactly what causes leukemia to appear in the body. Environmental factors seem to play a large role. Leukemia is treated different way for different patients. There are several treatment options. Most patients are treated with chemotherapy and drugs given with the purpose of killing cancer cells. Other patients will receive radiation, bone marrow transplants, or biological therapies. Osteoporosis. When you break down the word osteoporosis, it means coarse bone. Osteoporosis is a thinning of the bone due to a reduction in the density. It results in weak, fragile bones, increasing the chances of breaking and fracturing of the bones. Although osteoporosis can affect anyone, women make up the majority of cases in the United States. There are several factors that increase a person's chance of suffering from osteoporosis. After the age of 30, osteoporosis risks increase. White and Asian women have a higher chance of developing osteoporosis. Genetics also play a role. If a parent or sibling has this disease, a person will have an increased risk of developing it. There are ways to help prevent the development of osteoporosis. Individuals should ensure that they take the proper amounts of calcium and vitamin D in order to promote healthy bone growth. Persons should not smoke and only drink alcohol in moderation. Finally, weight-bearing exercise promotes healthy bone growth also. Scoliosis. Scoliosis is the curvature of the spine, referred to as a lateral curvature because the spine curves to the side. Most cases of scoliosis are mild, presenting issues such as uneven shoulders, one shoulder blade that is more prevalent than the other, an uneven waist, and one hip that is higher than the other. Although doctors are not certain what causes scoliosis, hereditary factors seem to play a large role, as scoliosis trends tend to run in families. Neuromuscular conditions, birth defects, and injury or infection in the spine can also cause this. There are several risk factors that increase your chance of scoliosis, in addition to family history. Age is a factor, large growth spurts during puberty are linked to scoliosis. Sex is another factor, girls having much higher risk of a curvature of the spine worsening. There are two main treatments for scoliosis: wearing a back brace for a period of time and surgery. Back braces are only used if the individual is still growing. The brace won't curve or reserve, or reverse the curvature, but it prevents the curve from worsening. The use of a brace is discontinued once there is no further change in height. If the scoliosis progresses over time, surgery may be recommended. The most common type of surgery is a spinal fusion. The spinal fusion connects one vertebrae to the next so they cannot move, reducing the curvature of the spine. Your skeletal system is a vital part of your body's overall health. Take care of it.